Better? Can you hear me? Okay. I am Liz Schaffer, the Executive Director for the East Central Pennsylvania Area Health Education Center, which I always say is a mouthful, so I like to say better known as your local AHEC. And I'm going to tell you a little bit about AHECs as well as the oral health mini grant that we got to do some fun things in the area of oral health. So, okay, so how many of you actually know or have heard of AHECs? And those that work with me, don't raise your hands, but okay, a couple. So AHEC programs were developed in Congress in 1971 to recruit, train, and retain health professionals. So all the talk that you guys have been saying has been like resonating in our ears, our AHEC people that are here, because our work primarily focuses on building the healthcare workforce, and we want to keep them in especially the rural and underserved communities. And so we're actually working really hard on doing that in helping our students really get that exposure to community and understand why we want them to live and stay and work here. And so we're doing a lot of work in that avenue. There are about 56 programs. AHEC is a national program. There are about 235 centers that changes here and there. But what's important for you to know is that in the state of Pennsylvania, there are 7 AHEC centers. So I am the East Central region. I cover Berks, Carbon, Lehigh, Northampton, and Schuylkill counties. But no matter where you go, you will find an AHEC center, and I think you should reach out to them. Our program office is housed in Penn State's College of Medicine, and for those of you, Pat, I'm going to call you out. Those of you who don't know Pat Bricker, get to know her. She is from our program office, and so we actually receive both state and federal funding, so we're very happy that everything got back on track yesterday. But each AHEC center is actually its own 501c3 nonprofit. So while our deliverables are determined at our program office level, and then that funding kind of is delivered down to us, we are also able to go after other sources of funding and programs and projects that fit with our mission, which is to enhance access to primary health care and really, be a part of that quality of health for people, help with quality of life, especially in rural and underserved communities. So our focus is really on healthcare workforce development and community education as well. So a lot of the work that we do focuses on working with community health workers. So how many of you have heard of community health workers? Okay, good amount. Yay. Community health workers are your trusted members in a community. And so a lot of this oral health programming, even at the basic level that you're talking about, can be accomplished by community health workers. Why? Because they build those relationships with those families. They're able to reduce that fear and stress of going, to a dentist or understanding what's going to happen. And so they really make it possible for people to actually address those oral health needs. And so they are really a great resource and avenue for incorporating oral health into, a family or client, a patient that they're working with to really help them improve in so many areas. And I know I'm preaching to the choir when I say, like, oral health is really everything. I know, right? I'm coming from public health and from an AHEC, and I'm saying, well, I get the oral health piece of it, right? But it is so important because it impacts a person's health and life in so many different ways. And so by using community health workers in this way, we can, put out that message and really be able to connect people to the services that they need. So we see kind of improvements across the board. Okay. Another advantage that community health workers have is the fact that not only do they work with these individuals in the community, but they also work with them in their homes. And if they're going into homes, they may notice things that not everybody else notices. And so I know yesterday we had a talk about the violence piece of it, right? A community health worker may really notice that whereas others may not. And so they can be instrumental like in that piece too. So of course in support and early detection, promoting even daily hygiene habits, brushing and flossing. It was kind of surprising to me to learn that some families, and I don't know, that y'all know this either, but in some families, like having one toothbrush is what they have, right? And it's like, wait a minute. That's not that hard to get. Well, for some families, it actually is, right? And so that's where that CHW can play a vital role in not only explaining kind of the importance of that, but help connect them to the resources so they can all get toothbrushes. Okay. And of course, that access piece, which we know is a huge issue, but helping them connect to the services that are provided, as well as culturally relevant resources and communication, all very, very important. The barriers, of course, the huge one, right, is the lack of dental insurance. And, you've said it here how many times, right, and that fight to be able to get, the services restored back to medical assistance is so important, but that ability to pay, it's not uncommon for individuals to, kind of put that off until an emergency happens, but also they don't realize that factor of, if you have a dental, problem, if you have an infection, it can kill you. How many people actually don't realize that that's an issue, right? So that education piece is really important. And again, CHWs can help with that. They can help with the language and cultural barriers as well, help with the transportation and potentially the child care issues and the lower health literacy that goes along with understanding oral health as well as fear of treatments. If somebody in their family, if they have had a bad experience at some point in time, that baggage goes with them. So now how are you going to get them into, the dentist? It's very hard to do, but that trusted member of the community, that CHW, is able to work with that person to kind of break down those barriers to be able to get them there. Okay. So something that the AHAC has done, and we're really proud of, is the fact that we offer an accredited community health worker training program. And you're probably like, what does this have to do with oral health, right? What it has to do with oral health is that actually East Central AHAC has been providing community health worker training since 2009. That's actually when I was hired to create the program. Very, very proud of that. In 2019, we brought it across to all of our AHEC centers and became an accredited program by the Pennsylvania Certification Board. We work very closely with them to make sure that our CHWs going through were certified. A critical part of this program, even from day one, was always oral health. It's something we've always included. Why? Because it's so important. And as I said, and I know I'm preaching to the choir, right? But it is something that impacts an individual kind of at all levels, from their general health, right, to their confidence in going to get that job, to like you name it. And so it's always been a critical piece. And so we make sure that that's one of our core competencies. And we've actually been lucky enough to, in most cases, she almost never says no, have the wonderful Kelly Braun come in and teach to our CHWs so they actually get that information about oral health and the basics and what they need to know to teach their patients and clients. And so, we know it's a huge need. We know CHWs can help with this, and so that's why it's incorporated in our program. So in addition to it being in our training program, something that the East Central decided to go for and do was we saw a need in our community for an oral health series in Spanish. Now, I do not speak Spanish, and when Amy asked me to speak, I was like, I don't have to say this in Spanish, right? Because actually our health educator that did the series for us spoke Spanish, Melissa Saunders, and she's no longer with us. And she's like, no, you're good. And I'm like, okay, then I can do this. So we applied for a mini grant to do a series. It was 3 parts, and we did basic oral health, the importance of fluoride, made sure we got that in there, and resources for individuals who have clients, who speak Spanish, and then have those clients or patients that need this information, but that need it in Spanish. And so we were able to do that, and I have to tell you, it was really funny. Some individuals who signed up for it were like, wait, this is in Spanish? Like, yes, this is purposely in Spanish because this is the population we want to reach. Do you have it in English? No. So that sparked some interest, and we're like, okay, we're going to put that on the list for the future, and maybe we'll see we find some funding to be able to offer it in English. But I was excited at the fact that people were like, oh, wait, we want this information, right? And so we trained community health workers, and we trained our medical interpreters as well in this information so that they could provide the info to the people that they work with. So we had the privilege of being able to record the sessions. They were done via Zoom. They were done in January, February, and March of last year. And, or this past year, I should say. And CHWs are now an accredited field in the state of Pennsylvania, and so they, in order to keep their certification, they have to have 30 hours of continuing ed credits over 2 years. So this series actually counts as 3 of those credits for them if they go through it. And because it's been recorded and it's on our LMS system, Academy of Mind, as long as you sign up for an account, you can actually go and view it. And so this poster here, if you scan the QR code, you can get to the series. And the way the series is laid out is that they could take just part 3 on resources, you know, or they can do the piece on fluoride. They don't have to do all 3, but they certainly are welcome to do all 3. And then this was a postcard that was created, and we actually sent this out to 10, we gave packs of 50 to 10 different nonprofit organizations within our region. As I said, we cover Berks, Carbon, Lehigh, Northampton, and Schuylkill counties. And so we disseminated these out through 10 different organizations that work with the Spanish-speaking population so that they would have some basic tips and resource information kind of at their fingertips to be able to you know, get at least some basic information. So we also do some other continuing ed opportunities for our CHWs, including a community health worker conference, which the East Central partners with the North Central AHAC, and we host an annual conference in State College. This year it's going to be our 5th conference. I'm so excited. I can't believe we've been going for 5 years. We get CHWs from around the state to come, CHWs, allies, supervisors, fantastic resources, you know, to be a part of it. And so, you know, it's just an amazing conference, an awesome opportunity for them to network. I highly recommend and invite you to come so that you can influence them a little bit on oral health. Although I have to say that PCOH has been a fantastic partner in presenting and being an exhibitor and being a sponsor and has been there all 4 years. So, and being able to, you saw their resource table, it's amazing. They provide those resources to all of our CHWs as well, and so they're getting this information so they really can be able to help. Again, that goal of the conference is being able to provide individuals with those resources so they can take them back to the individuals that they serve. Another project that we do is Pennsylvania AHEC's Training Center for Health Equity provides a CHW Echo series. I'm the lead facilitator for that. And we offer a variety of topics specifically geared to CHWs and resources and information that they may need in order to, again, be able to serve the population that they're working with. Those sessions are monthly. We've been going for, I said, like 2.5 years now, and they're all recorded as well. So we always kind of keep that in mind. How are we going to help these CHWs get the credits that they need so they can stay certified? And so we have over 24 sessions recorded that they can watch, that they can get credit for in a variety of topics. And we get over 100 CHWs at every session, which is pretty good for a series that's been going for 2.5 years. So if you have not had the opportunity yet to work with a CHW, I highly recommend that you work with a CHW. because they are a very, very engaged group. They want the information, they want the resources, they want to be able to advocate and to help. And so they're an amazing group of individuals. The work that they do really does save lives. And so we're happy to be in that space with them and support them and provide them with these opportunities so that they can then help and support the community in amazing ways. Okay, so again, how do they help? Just that connection, between the families and where can I go for dental help, or what do I need to do, or, kind of understanding just even the basics, right? Help them with the scheduling piece of it, help them maybe interpret or provide that navigation. We know the healthcare system's complicated, right? And for somebody who may have lower health literacy, or somebody has fears, somebody who's you're just not sure, having that CHW help them kind of navigate through that system can mean everything. It can mean the difference between them getting support and help and not, and then waiting till a crisis situation or getting, preventative care. And so again, really, really important things that they do. They also have that ability to build trust. Okay, so that it makes it easier for when they go to those dental appointments. So, we work with CHWs and train them all the time, and it's amazing when we can see the work that they do and how they're able to connect those individuals to the community. See, I didn't even get a card up, or not that I know, Amy. I did good, right? So here is my contact information. I'm happy to talk to you more about AHEC and all of the different things that we do. But oral health, has really become a focus area for us, especially I know North Central works really hard in that area, as well as, the East Central's looking to take that on a little bit more because we realize how important that is, and how if we can get that information out to those who are in need, we're just improving quality of life and maybe even saving lives. And that's the spot we want to be in. So thank you.
Thank you.